Hey everyone, Dr. Saida here. I'm a healthcare provider and advocate, and I'm deeply passionate about sexual and reproductive health and rights, or SRHR, as well as the urgent need for climate action. We often talk about these as separate issues, but the reality is, they're deeply intertwined. Climate change is already impacting our planet in drastic ways, and those impacts are felt most acutely by vulnerable communities. We're seeing more extreme weather events, rising sea levels, and prolonged droughts, all of which disrupt access to essential healthcare services, including SRHR. Imagine being displaced by a flood and losing access to contraception, or having a hurricane wipe out the only clinic in your region that provides prenatal care. These are the realities people are facing. This is why building climate-resilient SRHR services is not just important, it's absolutely critical. We need to ensure that everyone, everywhere, has access to the healthcare they need, regardless of the climate challenges we face. That's what this video is all about. Exploring innovative solutions to make SRHR services more resilient in the face of climate change. So picture this: a mobile health clinic fully equipped to provide essential SRHR services, traveling to remote communities, especially those most vulnerable to climate change impacts. These mobile clinics could be deployed to areas affected by floods, droughts, or other climate disasters, ensuring continuity of care when it's needed most. We're talking about providing access to contraception, prenatal care, safe abortion services, STI testing and treatment, and even mental health support, all within these mobile units. Think about the potential impact. No one should have to sacrifice their health or rights because of where they live or because of a climate disaster. Mobile clinics are a practical, effective way to bridge the gap and reach those who need it most. And it's not just about responding to disasters. These clinics can also be used proactively. They can travel to communities before a predicted climate event, providing essential services and raising awareness about climate risks and SRHR. Now, let's talk about the power of technology. Telehealth has revolutionized healthcare, and it has immense potential to make SRHR services more climate resilient. Imagine being able to consult with a healthcare provider, access counseling services, or even get prescriptions for contraception, all from your phone or computer. Telehealth breaks down geographical barriers, making it possible to reach people in remote areas or those who are displaced due to climate events. But it's not just about consultations. We can use mobile apps, online platforms, and even SMS-based services to provide comprehensive SRHR education and support. Think about young people in areas with limited access to information. They can use their phones to learn about reproductive health, contraception, consent, and healthy relationships. This kind of digital outreach is incredibly powerful, especially in the face of climate change. When disasters strike or climate impacts disrupt traditional healthcare systems, telehealth can ensure that people can still access the information and services they need. Disasters don't wait for a convenient time, and they often disproportionately affect marginalized communities. That's why we need to prioritize preparedness, and one way to do that is through SRHR emergency kits. Imagine a kit that includes essential menstrual hygiene products, contraception, basic prenatal care tools, water purification tablets, and even a whistle for signaling for help. These kits could be distributed to vulnerable communities, empowering them to take control of their health, even in emergency situations. The contents of these kits can be tailored to specific needs and contexts. For example, kits distributed in areas prone to flooding could include waterproof bags for important documents and medications. The key is to ensure that these kits are readily available, culturally appropriate, and designed with the input of the communities they are intended to serve. Because when it comes to emergencies, being prepared can make all the difference. We can build the most sophisticated mobile clinics and develop cutting-edge telehealth platforms, but none of it will be truly effective without investing in community-level capacity. We need to train community health workers, equipping them with the knowledge and skills to provide basic SRHR services and to promote climate resilience within their communities. These are people who already have the trust and respect of their communities. People who can provide culturally sensitive care and education. They can be trained to deliver first aid, provide prenatal care, distribute contraception, and educate their communities about climate risks and how to mitigate them. Empowering community health workers is about building sustainable, long-term solutions. It's about recognizing that the people closest to the challenges are often best positioned to develop and implement solutions. This one's about changing the system itself. We need to move beyond simply reacting to climate disasters and start proactively integrating SRHR into all levels of climate and disaster response planning. Governments and policymakers have a crucial role to play in ensuring that SRHR needs, particularly those of women and girls, are addressed in national and regional climate resilience plans. This means allocating adequate funding for SRHR services in disaster preparedness budgets, developing guidelines for protecting SRHR during emergencies, and establishing clear lines of communication to ensure that information about SRHR services reaches those who need it most. Integrating SRHR into these plans is not just about ticking a box. It's about recognizing that everyone deserves access to essential health care, regardless of their gender, age, or location. Let's talk about the products we use. Even seemingly small choices can have a big impact. We need to promote and distribute eco-friendly menstrual products and contraceptives, reducing waste and minimizing our environmental footprint. Imagine a world where biodegradable pads and tampons are readily available and affordable, even in remote areas. Imagine access to sustainable contraceptive options that don't contribute to the growing problem of plastic pollution. This requires collaboration, working with manufacturers, governments, and organizations to make these products accessible to everyone, especially in climate-vulnerable communities. It's about making choices that are good for our bodies and good for the planet. We live in an age of data, and we need to use that data wisely to inform our response to the intersection of climate change and SRHR. By collecting and analyzing data on climate vulnerabilities and SRHR needs, we can identify the communities most at risk and anticipate the challenges they face. This data can help us allocate resources more effectively, adapt SRHR services to meet specific needs, and develop early warning systems to prepare for climate-related health emergencies. Data-driven planning allows us to be proactive rather than reactive. It helps us target interventions where they are needed most and measure the impact of our efforts. It's about using the tools we have to make informed decisions and create a more equitable and resilient future for everyone. We've covered a lot of ground, from mobile clinics to telehealth, from emergency kits to the power of data. But the central message is this: building climate-resilient SRHR services is not optional. It's an absolute necessity. Climate change is already impacting the health and rights of people around the world, and those impacts will only intensify in the coming years. We have a collective responsibility to act, to innovate, and to ensure that everyone, everywhere, has access to the essential healthcare they need to thrive. This is not just a job for governments or healthcare providers. It's a call to action for all of us. Support organizations working on the front lines, advocate for policies that prioritize SRHR and climate resilience, and make conscious choices in your own life to reduce your environmental impact. Together, we can create a healthier and more just future for all.